I feel my clock is ticking. I've had cancer twice, and I think the system has to be adapted or changed. My first cancer treatment, I was not listened to. My second cancer treatment has been very good. I have also gone to Wellspring and Gilda's, and I've heard stories that are horrific. So I would like to be someone that does something. I want to see if there's any way I can be proactive.
Having, exposure to the healthcare system, significant exposure over the last 4 years as a result of a chronic illness, I didn't want to take advantage or feel like I was taking advantage of our system. And just, coming to have an expectation it would always be there.
I'm a 2-time cancer survivor. Small bumps in the road that when you're sick or when you're overwhelmed by a cancer diagnosis or any diagnosis of a serious illness, you just don't have the capacity to deal with. So if I can help someone else avoid that, that would be great.
One of the reasons that I joined the panel was that because I lived in the Northwest, which is a long way away from the center of the action, that would give me an opportunity to bring forward the issues that we have in the North.
It's a big puzzle, and you shouldn't have to be sitting there looking at all the pieces going, how do I put this together with no arms? You're sitting there with all these pieces, but you can't do anything because you've got no arms. That's the way I look at the system, and that's the way I looked at the system then. Now I've got a little bit of knowledge and a lot of luck, because it's a lot of luck to get through the system.
I had an appointment to go to London to a specialist who I have been dealing with since 2000. We were there like 5 minutes, and the secretary came over and said, "Can we reschedule you because we're backed up like 3 hours?" We had to pay for parking, which we wouldn't have had to pay for. If they had called and said, "We're running behind, can we reschedule you?" that's fine.
My daughter came down with encephalitis in January. When they sent her home the second day, the alarm went off at midnight that it wasn't functioning. They took her back to the hospital, and they found that the line had gelled. So they pulled that line out, put in another one, and in the process, this is a very invasive process, they created a blood clot, so she was quite at risk for some time.
My father was dying of cancer. He was in the hospital. I don't think he was treated very fairly. He was told not to get out of bed, right? Call for help when you need help. Call for help. You ring the buzzer. Nobody comes. They stuck him in a chair, in one of those chairs that can't move, and put a diaper on him. If the family isn't there to visit, but they're not given the same amount of care, that's wrong.
I have an acute traumatic brain injury, and having Dr. A tell me one thing and Dr. B tell me another thing, and then trying to navigate through find out information as to how to get the best treatment possible in my situation, and to understand what actually my issue is. And there wasn't a lot of answers.
I recently have taken on the role as a caregiver, and we had a very excellent provision of services, yet it made me reflect as my mother ages what that means for me in terms of my long-term planning, as well as it gave me a bit of insight on the areas in which the healthcare system could still adjust.
It'll give a broader knowledge as to what people are really experiencing out there, rather than what's being put forward either by the professionals or by the people that are deemed professionals but aren't necessarily the professionals doing it?
I think that I could contribute to the help to bridge the gap between hospital care and home care, the transition for patients in Ontario.
We're very lucky to be in Canada where we get free access to healthcare, but it's not perfect yet. And I know I've had a lot of not great experiences with healthcare. I've also had some very excellent experiences. So I think it's important to just be able to share those with the policymakers and people who are in the positions to make decisions.
The panel, I think, is a phenomenal idea. The people pulled together, just a great mix of people. And I think the idea that I believe that they're going to bring out of it is what's happening in the real life world with healthcare and what can change for the better, or how can we smooth some of the edges out and make the path easier.